Breaking bad news is a really common question in the interview. The reason for that is because it's going to put you under a lot of stress and a lot of pressure, and the interviewers want to see how you cope with a situation like that. As a doctor, you'll need to be breaking news to patients and also other doctors all the time, whether that be good news or bad news, whether that be test results or telling a patient about a diagnosis. In this video, I'm going to talk about my top tips for breaking bad news. So let's start off with tip number 1, showing clear empathy. So showing empathy is really important because you want to acknowledge the concerns of the patient or the patient's family. And the way to do that is to actually ask the patient how they're feeling and actually put yourself in their position. So maybe repeat exactly what they've been saying, or maybe repeat what you're saying again, just so that it's clear to the patient or the patient's family. Also, try to use phrases like, I can understand that this might be quite difficult, or I'm very sorry about this, just so that you are actually showing that bit of empathy and showing that you care about the patient. My second tip is to make sure that you never lie or show a sense of false security or false reassurance. So the reason for this is because you should never ever guarantee that you'll be able to fix a patient's problem or solve the issue that they have. The reason for that is because you're putting your patient in danger, and you're actually providing them with almost fake news. So you need to make sure that you aren't lying to the interviewer as well, just to please them. My third tip is to make sure that you remain calm. Now, this is something that you've probably been told all the time whilst breaking bad news. Remain calm or try to calm the patient down. Now, the one thing that I would say about this is the best way to remain calm is just to try and maybe take a few seconds out, or just try to keep your language very, very simple. The reason why you need to remain calm is because the interviewer is trying to crack you. They're trying to put you under lots of pressure. So the one thing you don't want to do is, for example, buckle under that pressure and completely stop the interview or stop the station, which is sometimes quite common in students' experiences. My next tip is to give a warning shot. So what do I mean by warning shot? Well, what I mean by this is actually explaining to the patient that you are about to break some bad news, or you're going to tell them about something which they might be a bit upset about. So one thing that I would say is something like, the results have just come back and there are some concerns with these results. So at least you're giving the patient or the patient's family a bit of a warning, so that they can start to process that information. A bad thing to say would be, for example, the results have come back and you have cancer. So you're just putting the patient right into the danger zone, you're giving them bad news, but you're not being empathetic and you're not giving them a lot of time to process that information. Now I'm going to go through the very important acronym SPIKES, which we were taught at medical school and is very useful in breaking bad news to patients or their family members. So let's start off with S, the first S, which is setting. Now, you should always find a good setting when you're talking to a patient or breaking bad news with them or their family members. Now, the reason for that is you want to be in a quiet, comfortable environment so that they can ask questions to you and you can talk to them about the matter at hand, and also to make sure that you don't disclose any confidential information as well. In the MMI, obviously you won't be able to change the setting or environment, but maybe the manner that you walk into the station or walk out of the station might be quite beneficial. Another thing is that, say for example, an interviewer asks you about, for example, what are some advice that you would give to a doctor who is going to break bad news? Well, maybe you can tell them about the setting and how important it is to go into a quiet and comfortable setting. And if you're doing the interview online, for example, make sure that you're sitting up, you're presentable rather than slouching down, because breaking bad news is something that's very important. So the interviewer wants to know that you're actually taking this seriously. The next part of SPIKES is P, standing for perception. So perception is very important because you want to understand what the patient's perception on the matter is. So really ask them questions about, what do you know? Where have you found certain pieces of information in the past? So maybe use those things like the 5 W's, like who, what, where, when, why, how, and ask patients questions about how they're feeling or what they know about the situation already. Why is this really, really important? Well, it's really important because first of all, you're going to save yourself a lot of time. And also this way you will understand what the patient actually knows already about the situation. So the next part of SPIKES is invitation, which just means you want to invite the patient to actually, ask them whether they'd like this information. Okay, so that means that, for example, if you have a piece of information about their diagnosis in front of you, you should ask the patient, would you like me to share this with you? That's all it is, keep it very simple. So the next part of spikes is K, which is knowledge. And knowledge is basically just saying breaking the bad news itself, so actually explaining what the diagnosis is to the patient. Now, before you do that, again, you should give a bit of a warning shot. So you should say that, for example, the news that I'm going to tell you is quite bad, or it's something that you might feel a bit upset about. At least this way you're giving them a bit of a warning before you're breaking the bad news. And then also, once you break the bad news, make sure that you pause, okay? Allow them to process the information rather than rushing into lots of details. The reason why we pause is to actually allow the patient or the patient's family to maybe think about what you've just told them, and to allow them to speak as well. So the next part is E, for empathy. Now, when you break bad news, you need to show empathy. You need to show as though you care for the patient or the actor or the family members in a situation like this. So make sure that you explain to them that you feel really sorry, and that you should ask them, can I do anything for you? Is there anything that you'd like me to do? Again, don't promise anything, but just try your best to show that you care about the patient and their family. So moving on to S. Now, S stands for summary. Now, it's a bit difficult to kind of give a summary with regards to the next plan of action in an MMI interview. So maybe suggest that you would give them a leaflet or something to help them for the future. But again, this last part of spikes isn't something to worry about. It's more about just making sure that the patient feels okay and you're moving on to the next step now. So breaking bad news can come in very different forms. It might be actually diagnosing or telling a patient that they have cancer, or it could be explaining to one of your friends that they haven't got into university, or comforting them with regards to that. So just keep to the spikes technique. So make sure that you are being as empathetic as possible, and always make sure that you give a warning before you break that bad news. Make sure you see our next video, which is all about a real life candidate who is breaking bad news. Thanks for watching this video. Click below to subscribe and catch more of our videos. To watch our full online course and find out how you can enroll onto our award-winning program with personalised one-to-one tutoring, online weekly webinars and more, click here.